Welcome to the 3G Fitness Podcast,
where three generations of trainers come together to discuss all things fitness related.
Join us as we share insights, tips, and stories from our diverse experiences as we unravel the secrets of staying fit.
Welcome, ladies and gentlemen, to the 3G's Fitness Podcast, Three Generations of Fitness. I'm Coach Cisco.
Coach Michael,
Coach Kyle.
And today we have two special guests. First, in the lovely bright yellow shirt, we have near dear friend of mine, exercise physiologist, over 30 years of personal training experience, Stan Wada.
Yes, sir.
Hello. And
Yes, and in the middle we have Dr. Young Trinh, MD, an internist by training, associated with Memorial Care Medical Group, and sees patients in the OC area. He's the Chief Medical Officer of the Healthy Brain Clinic in Long Beach, and is involved with Alzheimer's, brain health research, risk reduction, strategies, and public education. He is on the board of Alzheimer's Orange County, hosts a radio podcast public education series called Health Talks with Dr. Trinh, and graduated from New York Medical College with residency in internal medicine at Loma Linda University Medical Center.
wow, welcome on here, Doc.
Extensive.
For the fall.
Well, as Kyle was reading off those credentials, tell us more about your current credentials. Off camera, you were telling us that's a little bit outdated. man.
It's pretty legit. I've done a lot of type of work in the past, but my love really is education and educating the community, educating physicians. Did a lot of education for medical students and residents and all that. So that's kind of my passion as an educator. But in the background, we do research. We do research on brain health, which includes Alzheimer's and dementia. We've done research on microdosing of LSD and psychedelics.
Oh,
We've done
nice.
lots of different types of research projects that we're currently doing in the background with that. Yeah, so just fun stuff.
That's fascinating.
Mike, what you got over there, man?
well, my question, it's just a question that I think is asked by a lot of seniors. What's the difference between dementia and Alzheimer's in the simplest term? Okay, not the, I know there's a medical term that you use, but in the simplest term that the average person could understand and see where it falls at.
So dementia is a big umbrella of all conditions that affects the brain as far as memory loss and thinking and cognition and all that. One big umbrella. So under this big umbrella, Alzheimer's take up 2/3 of the umbrella. So 2 out of 3 patients with dementia have Alzheimer's dementia. What that means though is the other 1/3 of patients with dementia do not have Alzheimer's dementia. They have dementia for other reasons. For example, you can have dementia from Parkinson's disease. Right? You can have dementia from having a stroke or a brain tumor. You can have dementia from vitamin B12 deficiency, hypothyroidism. You can have dementia from having your head hit on traumatic brain injury, chronic traumatic encephalopathy, right? Boxers, things of that sort. MMA fighters. You can have dementia for many other reasons, but those other reasons take up 1/3 of dementia. Alzheimer's take up 2/3 of dementia. The most common type is Alzheimer's.
And then I saw on one of your podcasts that you did several years ago, you mentioned that Alzheimer's is one of the top diseases that kill people in Orange County.
It's
Yeah, you said it's number 3.
Yeah, number 3 cause of death in Orange County. Number 3 cause of death. The number 1 cause of death is heart attacks. Number 2 cause of death is cancer. And in Southern California, number 3 cause of death is Alzheimer's.
You started to scare me.
It's an epidemic that nobody wants to talk about. It's a silent epidemic. Nobody wants to use the A word, the Alzheimer's word. The Alzheimer's word today is what 30 years ago we used the C word, cancer, right? Nobody wants to talk about the C word 30 years ago. Now everyone's talking about the C word, but the A word is now that C word. Nobody wants to be tagged with that term because it sounds scary. It sounds like it's a death sentence and it's one-way road. And that's what we work on.
See, because that was new to me. I never correlated Alzheimer's and death together. You know, I'm only 37 years old. So this is something that has never crossed my mind a lot. Yeah, I do train a lot of older clients where it gets brought up. So to me personally, like I never correlated any of that. Can you like help me understand what Alzheimer's does that?
Yeah, so nobody drops dead from not remembering. What happens is that in the beginning stages of dementia and Alzheimer's, you just forget little things like, what's that word I wanted to say? It's not coming out. I'm forgetting names. And then just little things, walking into a room, why am I here? Or, what time's the podcast again? Which day is it? Right,
Quit looking at me.
I'm dealing with it too.
just little things.
But Kyle's like, me
Dude, I'm dealing with this too.
These guys are looking at me.
But as things progress, right, there's a plaque that builds up in Alzheimer's. We call it the Alzheimer's plaque. It's a specific protein that's associated with Alzheimer's. The scientific name for it is the beta amyloid plaque that builds up. So if you got Alzheimer's, you got this plaque that's in your brain. 100% is required for the diagnosis. If you don't have that plaque in your brain, it's not Alzheimer's. But what happens is that over time, plaque builds up. By the time somebody's diagnosed with Alzheimer's here, and this is like a timeline to that diagnosis, this Alzheimer's protein, this plaque, this amyloid plaque, has been building up for 20 years, 2 decades. 2 decades of plaque buildup, silent, quiet, no symptom, no sign. Your memory's perfect for 20 years until it overwhelms the brain and the brain cells start to give up and they start to die and things of that sort. But so in the beginning, it's just forgetting words, forgetting names, small little things. But as time progresses and plaque continues to build up, now you're cooking and you forget to turn off the stove. Or the keys are in the refrigerator and you don't know why it's there. Or you're driving and all of a sudden, where am I going? How do I get home? Right? It's the same route. And so it starts to get more serious over time where you start to need help at home. So you can't do complex tasks anymore. You used to be able to do the bills, you can't do the bills. You used to be able to do your own taxes, you can't do your taxes. And then you start to need help. Somebody has to cook for you, clean for you, as the times get more serious. And then at some point, you need help at home where I have to ask for a home health nurse to come and make sure things are safe. So home health comes, and at some point, you don't know how to take care of yourself. You stop cooking, you stop cleaning, your conversations become limited. You forget that you're hungry, or you forget that you've already eaten, you eat again. And then you forget to take your pills. So if you forget to take your pills, your blood pressure gets out of whack, your diabetes gets out of whack, your other conditions get worse. And as time progresses, you end up just being bedbound most of the time. And that's when I put you in a nursing home. That's where you die. That's where you die.
What causes this plaque to build up?
What causes plaque to build up?
Yeah.
So I gave these 3-hour seminars on plaque buildup and how to prevent it at many churches. As a matter of fact, November 15th, right off of Refuge Church, which is right across from Bellaterra. There's a church there. Yeah, I'm going to be there for 3 hours Saturday morning. You guys are totally welcome to come. At Refuge Church here in Huntington Beach, November 15th from 9 to 12. We're going to talk about what causes plaque buildup and how to prevent it and how to live that lifestyle, which includes exercise and working out. It's one of the biggest factor in Alzheimer's prevention is the stuff you guys do, right, at the gym and for your clients and things of that sort. But yeah, that's how people die, is they end up bedbound and they die in nursing homes. Number 3, cause of death written on a death certificate. So whenever somebody dies, you got to write like cause of death, right? The doctor needs to write down cause of death. So number 3, cause of death on a death certificate is Alzheimer's.
That is crazy.
In Orange County. Yeah.
So exercise. How big of a factor is it?
It is probably the biggest
in
factor.
Preventing as well as diet.
Wow.
Between exercise and diet, those two are the biggest factors in reducing the risk of Alzheimer's. Exercise and diet. I would say exercise is even more important than diet. Biggest risk factor. And we have data that shows it. we have data that's been published. We have clinical trials been published showing that exercise is consistently like almost the number one thing you can do for your health. And not just for the brain, for the body. Because what's good for the brain is going to be good for the body. What's good for the body is going to be good for the brain. Right. And this is why I'm here at this podcast and looking forward to doing this podcast, because you guys are, coaches in the world of exercise and strength and things of that sort. It is the biggest factor. And so you don't realize it, but you're playing a role in reducing the risk of Alzheimer's. Every one of you guys are.
Well, then let me ask you this. Is there like an average age where Alzheimer's kicks in? I know you talk about the 20-year buildup in the plaque, but is there like an average age group?
Yeah. So from age 65 to age 70, your risk of Alzheimer's doubles. From 70 to 75, it doubles again. 75 to 80, it doubles again. 80 to 85, it doubles again. So it keeps doubling every 5 years, starting at age 65. So that by the time somebody's in their mid 80s, 1 out of 3 have some form of dementia.
Oh, wow.
In the mid 80s. In the mid 80s.
And so, damn. So, like I said, now, and I love that you're bringing in the coach, and we're going to bring in your personal coach as well, too. Stan's a near dear friend of mine, too. I love you, brother. And I know you specifically have a clientele of the age group that Dr. Trinh was talking about. What personally have you been doing with those kind of clientels, and what kind of exercises do you mainly focus on to help them out?
So it's funny how you mentioned that, because I kind of stumbled into training older adults. My original background was sports performance, out of San Diego State. Strength and conditioning is what I specialized in. But since training general population for the last 30 years, my clients got older. And before I knew it, since a lot of my clients, I've been with them for over 10 to 15 years, they kind of fell into the older adult cohort. And what ended up happening is I started focusing on different types of strength training and movement, and started focusing on what we call activities of daily living, and making sure that these older adults can just function doing day-to-day activities that help them just with their life. And so that's one of the main changes that I made. And then the other thing I also focus on, what we call neuroplasticity, which is having the cognitive ability to be able to expand from what they're currently doing. So I started altering some of the exercises and added different kind of movement patterns so that the brain has to learn. And as long as it keeps learning, it's going to start using more brain cells, which can help combat either combat or delay the onset of Alzheimer's.
Yeah, because I've been seeing you lately too. It's I like one of the exercises that I see you do. So you just tossing frisbees at your clients to test their coordination.
Yeah, so there's the hand-eye coordination, the tracking, just see, and then there's also this recognition. If you start watching how their eyes track the discs, you can see the recognition. Do they react fast enough? So I look for different things like that. I look at their just see how their feet move, their hands move, and see if they could coordinate them together. And it's funny because over time, and this really happened with my father, because I started training him, and he's 83, and his biggest fear is Alzheimer's, because he has his 2 sisters have it. His mom died from it, so that's his biggest worry. So I started working with him, and then I noticed he started improving. And exercise is probably one of the best intervention programs for Alzheimer's.
I wouldn't have thought that.
Yeah.
I worry about it, especially now that you said 65 to 70. Come on, I'm 68, man. But no, I do worry about it, and I would probably say, being at 68, I probably go to the gym consistently now more than ever. I may talk when I'm there, but I do get it done, because I know someone's going to say something, but I also feel I earned that right to talk, because I've been doing it for so long. But, it worries me, so I definitely try to, eat more fish. I try to, eat more plant-based stuff, and I definitely go into the gym probably 4 or 5 days a week. And I don't, like these guys train a lot of people. I don't, but I do look at myself to train myself, because I've read that, to prevent it, exercise is one of the best forms following diet. So I do follow, that route, because you start getting up to that age, you worry. You don't want to, but it's something that is hard not to. So I try to tell people, I go play golf and I go try to do these more active things that I can possibly do to stay active. And I tell my golf partner all the time, you gotta move more, we gotta be more active. If you're just stagnant sitting there watching TV, I think that does more harm for you, So getting out, walking your dog or walking your cat, whatever it be, you it's something that's important to do.
Yeah, what's interesting is that we're starting to see data within the last 2 years showing that being sedentary, meaning sitting around all day, is really the new smoking.
I believe it.
Wow.
It's really the new smoking.
And Alzheimer's now considered diabetes 3, right?
Alzheimer's is considered diabetes type 3. Just because tons of diabetics, if you have diabetes, it doubles your risk of Alzheimer's.
Oh, wow.
And of course, it all goes back down to exercise and diet and diabetic prevention, right? And so when people think of Alzheimer's, they think of two things. I'm just going to get it when I'm older, and it's genetics, right? Genetics play a small role. Lifestyle is the bulk of Alzheimer's, and lifestyle is modifiable.
So then, just going off of that, because that was going to be my next question. Stan training your dad, and it sounds like it was in the family or anything like that. Me, if it's not so predominant in my family, I could still get it without even seeing it so much in my family.
Absolutely, more lifestyle than genetics. We have tons of patients with Alzheimer's that don't have a family history,
Really?
and that we see on a regular basis. So it's lifestyle.
You mentioned medication, okay? We always hear that pharmaceuticals are always trying to make money. Now, when you talk medication, you talk about medication preventing Alzheimer's or controlling it or slowing it down.
So if you're talking about medication as far as prescription medications, there is no prevention prescription medications.
Okay.
But we do have FDA-approved medications that will remove the plaque. But
is there something in the future that
we are
on?
working on
Okay.
prevention. We're doing these clinical trials at my office on prevention. We did the clinical trials for these medications that have been recently approved that removes plaque. We're part of those clinical trials. So those are the things we're actively doing. But the best prevention really is lifestyle. I mean, let your food be your medicine. You don't need to pop a pill, right? Let your food be your medicine. Let your lifestyle be your medicine. There are supplements out there, but it's been said that in the United States, we have the most expensive urine in the world because we pee out our supplements that we don't need, right? We pop a bunch of stuff.
Yeah.
But let your lifestyle be your medication, and if needed, a prescription.
But there are countries out there with the lower Alzheimer.
There is,
like Japan.
Lifestyle related.
because it's lifestyle.
Is it lifestyle?
Yeah, it's lifestyle.
Diet here.
It's lifestyle.
Or like fish. They say is
They eat fish. Not everyone in the world has a car like we do. Like here, we would drive 5 minutes to go somewhere. Rest of the world, they walk.
Yeah.
Right? They get their physical activity in.
So they're a lot more active.
They're a lot more active.
That makes a lot of sense.
Yeah.
See, this is all blowing my mind right now. Because I honestly, like I said, being young, seeing it on TV, seeing it on movies, and even just hearing from clients, because clients come up to me and they're afraid because mom and dad had it. So they don't want to go. So me being young, very naive to this topic, I was more of under the impression that this was hereditary. This was something that got passed down. So right now you're just like blowing my mind on it. It could be anyone.
Yeah, bring all your clients to Refuge on November 15th at 9 o'clock. We'll do a 3-hour lifestyle session. Just promote it.
But the exercise doesn't have to be difficult. I mean, you just have to get 4,000 to 7,000 steps a day. The 10,000 marker is just something that someone set up. I think it was set up in Japan. The Japanese set it, but 4,000 to 7,000 makes a huge difference. You can cut it down by 40%. So it's one of those things you could just start off easily.
Yeah.
But like even if you get moderate to vigorous exercise 3 to 4 times a week, it will really help cut down. And some of the clients that will tell you that, oh, I walk, well, it's not good enough. You really should do some form of strength training. Now, that doesn't mean you go underneath a squat rack and you start squatting your body weight, but just simple exercises, even if it's assisted, will make a big difference.
Yeah. And what exactly is happening in the brain that's allowing this to help prevent Alzheimer's during exercise?
So let's talk about strength training. There's actually good data on strength training and Alzheimer's risk reduction. Good data. And there have been several clinical trials that's been published with just lifestyle intervention, no medicine, no pills, no prescriptions, showing that lifestyle intervention reduces the risk of Alzheimer's. And these lifestyle intervention that were published in clinical trials include strength training as the intervention, right? Working out 2-3 times a week with a trainer makes a big difference. So the question is, what's the science behind that? When you are flexing your muscle, right, and as you are building lean muscle mass, several things happen. First thing is that muscle soaks in glucose, because as you're using your muscle, right, you're sinking glucose, you're sinking sugar. So so basically it lowers the risk of Alzheimer's. The more muscles you have, the more sugar you're burning.
Okay.
Makes sense? Because the muscles require sugar.
I like that.
The more, the more muscles you have, the more sugars you
As
burn
glycogen.
at a baseline,
Yeah.
right? Assuming you're using your muscle. The second thing is, when you're flexing your muscle, you're not just flexing your muscle, you are releasing hormones from the muscles themselves. These hormones are called myokines, myokines, myokines. So there are several different myokines released from the muscle. And one of these myokines is called BDNF, brain-derived neurotrophic factor. It is a hormone that is sent from the muscle to the brain, brain-derived neurotrophic factor, BDNF. And BDNF, once it gets to the brain, its purpose is to protect the brain and protect the brain cells. So it lowers inflammation. It lowers any adversity in the immune system, and it protects brain cell, and it increases what we call neuroplasticity, neurogenesis, the building of new brain cells. Right? Most people say, oh, can you make new brain cells? Or do you got what you got and you can only lose it? The answer is you can make new brain cells. And new brain cells is made from the stimulation from BDNF, and BDNF comes from the muscles when they are flexed. And so that's another scientific factor.
Yeah.
I'm like saying that Kyle, man.
I know.
I flex in front of a mirror without a shirt on
All the
at least
time.
twice a day. And so I'm like,
That's more.
I think it's BDNF.
he's
Yeah,
helping. That's what I was
exactly.
like, I'm all like, dude.
I'm improving my neuroplasticity. You know.
No, please
Yeah,
keep
you
your
got
shirt
to.
on.
Let's go.
Keep your shirt on.
You keep your shirt on. Yeah,
So you're making new.
Sound that bad.
Hey, come on now. Well, I'll have a session right after this.
You could be
no,
surprised.
because
Yeah.
that's so fascinating. I never.
Yeah.
But-
and that's not all. When you're flexing your muscle, you are contracting the blood vessels that run within your muscles, right? You're contracting these blood vessels. When the blood vessels contract, guess what? It's pushing
better blood flow.
up to your brain. So it's
Makes sense,
improving
makes sense.
circulation, right? So when you're working out, when you're doing cardio, and when you're flexing your muscle with strengthening, you're compressing blood vessels that is improving circulation to the brain. And
carries all
anytime
the
you improve
nutrients.
circulation to the brain, you're helping brain cells.
Yeah.
You're removing toxins and you're reducing inflammation. So all that happens with strength training.
Well, so doing exercise, can that improve a person that is already diagnosed with Alzheimer's or dementia?
Great question.
Can it improve it?
So I was I was in Toronto in July at the Alzheimer's Association International Conference. So once a year we have this international conference, and it's a different location every year. Last year it was in Spain, year before that Amsterdam. So this past July I was in Toronto. There was 10,000 of us internationally that flew into Toronto, where you get the latest updates on Alzheimer's disease, the latest diagnosis, the latest research, the latest medications. And there was 2 studies that were published. that was presented and published in medical journals. Both studies that were published were studies with lifestyle. No medication, just mainly lifestyle. No prescriptions. And so in one study, they took 2,000 participants who were at risk for Alzheimer's. They didn't have Alzheimer's. They were at risk for Alzheimer's. They're older. They were like from age 60 to 79. And they took baseline memory testing, and they tracked them for 2 years. They told them to exercise, diet, socialize, do brain games. And what happened was 2 years later, in these 2,000 participants, that they kind of broke down to two different categories. One group was just told to do this. They were given a list, and they were just told to do it. The second group was given the same list, but they had a trainer. They had a coach. And both groups 2 years later improved on their cognition, their memory. The group that had a coach or a trainer improved even better than the group that was just self-directed, told to just do it themselves. 2,000 participants, we can improve memory. Now, the second study that was published was in those who were already given the diagnosis of Alzheimer's. Already diagnosed, but they were in the mild early stages of Alzheimer's. The early stages. So mild dementia, mild Alzheimer's, and a stage called MCI, which is kind of like pre-Alzheimer's, mild cognitive impairment, MCI. So in this group, smaller study, but very relevant. It came out of UCSF, UC San Diego, and Harvard. This group, same thing, already diagnosed, told to live that lifestyle, and they had a health coach to coach them through. The study wasn't 2 years, it was only 40 weeks, which is like 10 months long. Already diagnosed, broken down to two groups. One group was like the control group. They were told, live your life, don't do anything different. The second group was the group that was told to exercise, strength training, cardio, diet, nutrition, all this lifestyle stuff, right? So at the end of 40 weeks, the group that was told to do nothing different with your life, 70% of them, their memory declined. 70%. Because these folks already had Alzheimer's. They're already diagnosed with Alzheimer's, right? So you expect a decline. Because if you got Alzheimer's, it gets worse over time. The group that lived the lifestyle, no prescription, between being stable with their memory at 40 weeks, meaning no decline, they stabilize, and improving their memory, that two category where they stabilize or improve, 83% of those folks that participated improve or stay stable, did not decline, compared to the 70% that declined when they did nothing. It shows you that lifestyle makes a big difference in improving your cognition without a prescription. It's our lifestyle, guys. And you guys are playing a major role in that lifestyle. You're playing a major role.
So I like how you mentioned that the study group were working with coaches, being the importance of coaches. We have your coach right here too. And I know you're taking certain classes as well right now too, Stan, that helping you broaden your understanding of this topic. And I think you mentioned off camera something about like there's a certain gender that might have to be more.
So currently I'm working on my master's at gerontology at Cal State Long Beach, and took a women's studies class last semester. 2/3 of Alzheimer's diagnosis are women. So strength training is very important for women. Not only helps with just their brain function, helps with osteoporosis, obviously. And the other one is menopause. And the thing about with women that they don't understand is that there's only two phases. It's premenopause and menopause. There really no such thing as post. It's just once you have it, that's it. And the hormones kind of, it's different for every you know, female. So it and there's no one size fit all type cure, but exercise tends to be the best intervention for all their symptoms, and obviously for Alzheimer's disease. So
what's the reason behind that? Like what makes them different that makes them more susceptible to that?
Actually, I'm not 100% sure on why the reason is, but
yeah, I think the men drive them crazy.
I see.
Yeah, that could be it, man.
part of it is hormonal. Part of it is hormonal, but
Okay.
I'm not exactly 100%
But
sure.
that's what I would think, because like I said, when women are going through menopause, it's a complete drop of hormones, right?
Yeah.
The complete change. So I think whenever women are just going in a complete change of hormones, their body is just. My wife is currently pregnant, right? She's going through a change of hormones, and thankfully she's having an easy pregnancy to my standards from what I've heard of other people. But I've heard other people, when they're going through pregnancy, their hormones are through the roofs. You get pains, you get aches, you get it. I could understand it. Why I just don't. I would probably want to look more.
I know it's hormonal based on this fact. My father just survived prostate cancer, and he went through radiation treatment. And they also shut down his production of testosterone. So he's going through what we call menopause. So he's experiencing hot flashes, and he's not able to synthesize protein as well, just because of what's going on with his body. So that's another reason why I've started working with him for strength training and actually trying to get him to eat more protein. So, hormones has a lot to do with.
Yeah, the lack of estrogen protects the brain. So estrogen protects the brain. So when you don't,
That's a
have
huge
estrogen,
drop in estrogen.
Yeah,
when women are going through
it
all that,
leaves the brain a little bit more vulnerable. The second reason women are at higher risk by 2 to 1, right? As far as the diagnosis of Alzheimer's, is that women in general live longer than men. So you know how every 5 years this risk increases?
Yeah.
Right?
So
So women live longer than men by, at least 4 or 5 years, so that risk increases as well.
that makes sense.
So
Well, they don't need us.
they don't need us, but are you saying we need
We
them?
need them, but they don't need us.
You're damn straight. We need women. they carry the baby.
Yeah, honestly.
Where am I gonna push one out? Shit.
Yeah.
The hell you talking about?
Yeah, I mean, I wish I can push one out, but it just, God just didn't create me that way.
Stan, you mentioned about your father too, and like protein synthesis, and how old is your father right now?
He's 83.
He's 83, right? And I think Mike has explained to us plenty of times how when it comes to elderlies and protein intake, it's not the same as it is when it comes to us.
Yeah.
So I mean,
that's like they call it anabolic resistance. That that happens to just about everybody, but it's more the seniors that they take protein, but it doesn't sink in as well as a younger person. So I almost like double, my dosage when I take protein. I probably, protein powder. I probably do close to, 80 grams of protein. So I take almost double that, which is about 20 grams per scoop.
Yep.
I probably take 80 through a day, and that's not including what I eat. So I'd probably say I'm way over 100.
Right.
But I'm probably getting half of that.
So the big picture is, why do we need protein? Right. And so it boils down to muscle mass.
That's it.
Right. Your muscle is protein. And over time, as we get older, we lose muscle mass. We lose percentage of muscle as we age. And the loss of muscle mass is correlated with longevity. So the less muscle mass you have, the higher risk of falling down, breaking a hip, being unstable, and the high risk of death in general, which is why as we get older, it is even more important for strength training compared to when you're younger.
Gabrielle
super
Lyons,
important.
she says muscle is the organ of longevity.
Muscle is the organ of longevity. Very true. The less muscle mass, the shorter lifespan. It's correlated.
I try to tell these guys quit worrying about me tripping. I'm okay.
yeah, you catch.
Adding.
Yeah.
But
So,
go for it.
I was going to say, so speaking of protein, right, I think that is one of the supplements. So what other supplements can work and would benefit just preventing Alzheimer's?
So the first thing to understand with supplements is that it's supplemental, not the main thing to your health, right? It supplements your diet, your exercise, your lifestyle. It's not like the thing that's going to cure anything. It's a supplement. The second thing with supplements is that supplements only work if you have a deficiency of something. For example, if you got a deficiency of calcium, right? You can supplement calcium to get it to a good range. But taking more calcium, if your range is good, taking more of it doesn't help. If you have a deficiency of vitamin D, you can supplement it with vitamin D supplements. But once it's in good range, there's no extra benefit of more vitamin D, right? So that's the first thing to keep in mind, is that it's supplemental and it helps if there's deficiency. But there's no benefit to like mega dosing of anything over it. You're just going to pee it out, right? If it's water soluble, you pee it out. You're just wasting the supplement. So that's, but the supplements that's been known for brain health would be like fish oil, right? If you don't like fish and you need the omega-3, your brain is mainly fat, and your brain is mainly DHA, fatty acid, which is basically part of fish oil, right? So DHA has been known to help. Other supplements that's been known to help would be vitamin B complex, mainly vitamin B12, good for the brain. So there's a number of supplements out there. There is emerging evidence that creatine will help with the brain as well, other than just building muscle. There's emerging evidence. It's kind of early still. There's not like a ton of data, but the data that has been around that we have shown shows a positive correlation.
But we produce creatine within ourselves, so taking more creatine doesn't really.
Unless you're working out and you want to build more muscle faster.
Okay.
Right?
I want to make sure I was doing the right thing.
Yeah. So for those who are like bulking up, right, then they take the additional protein to help build those muscles at a faster rate. But you don't have to take it if you're like, if you're eating your steak and your meat and all that. But if you want to bulk up faster, obviously.
What's the best fish? All fish, or just like halibut, salmon, and stuff like that?
For
really
brain
good.
health, you mean?
Yeah.
The best fish for brain health are the fatty fishes,
Which
are salmon, mackerel, sardines. The fatty fish has more omega-3 than the non-fatty fish. The non-fatty fish would be like tilapia.
Yeah.
So you want fatty fish if you want more omega-3 for brain health. And the other thing is wild versus farm fish. So wild fish is obviously going to be healthier than farm fish with that.
Asian fish,
So
Mike.
why they laughed, I don't know. Because
Asian fish, Mike.
It just came out of nowhere. Yeah, it just came out of
We were talking
nowhere.
about fish omega, but
what's the best fish? I want to know.
What's the best fish?
But it's not a bad. It's like it wasn't a bad question.
It was a good question.
I always thought salmon was a good fish.
It is a good fish.
Yeah.
It's fatty.
It's my
It's
go-to
fatty.
right there.
It's good fish.
You got
Mackerel. Mackerel's an Asian fish. That's really fatty.
tuna.
Mackerel.
Mackerel.
I don't eat mackerel.
Why not? Smelt's pretty good
So
too.
get your sushi
As
in.
long as it's fatty, the fatty fish is the best. You guys are making me hungry. We're gonna
I know,
lunch
right?
after this, right?
Yeah,
Do
exactly.
some sushi.
There's some
after this.
sushi all you can eat
There you
right
go.
down the street.
We're all
man.
going.
No, I'm not
Where?
going to that one. I'm not going to that
Mike, well, we
one.
can take Mike and show.
AYC? No.
Yeah, let's
No,
go.
but
I'm done.
I was tragic last time I went.
But I love, Doc, that you explained like supplements, and it's more on the deficiency part, because I do believe when I'm dealing with a lot of my clients, and I do have a good handful. I would probably say almost more than half of my clients are over the age of 50 now, and I am seeing it very commonly that protein intake in their food is very lacking. It's like I even tell a lot of my clients, I'm all like, you guys should at least aim for 100 grams of protein. Just aim for that, because I found out, and I think I did a study too. I mean, the average person is maybe getting 40 to 50. And so I think when I'm a big proponent on trying not to rely so much on the supplement, but I feel like, hey, you know what? If this scoop is going to give you 20 grams, maybe have it twice a day.
Yeah.
And then try to find the other, 60 grams in food.
Yeah.
So nobody knows, like in real life, what 100 grams of protein means in food. Is it a hamburger? Is it a steak? What is 100 gram of protein in food? Like, what is it?
A hamburger steak is
basically
generally like 20 grams ish, I would say.
So 5 hamburgers a day should be eaten.
Just about.
It's like three chicken breasts.
Three chicken.
Or
three
three
chicken
chicken breasts.
Is 100
About close to 100 grams.
I would,
Okay.
Yeah,
that's
because
about
about
A chicken breast, like what, 6 to 8 ounces? 6 to 8
ounces of
3 to
chicken.
4
White
ounces.
chicken breast is 25 to 30 grams of protein.
Okay.
That much?
Yeah, it is.
Yeah, it is.
chicken breast
Chicken
has
is higher for
good.
sure.
about-
Yeah.
Chicken breast.
is
Wait, what
higher,
about
yeah.
a drumstick?
No, there's a lot of
Drumstick
fat.
has-
That's mostly
drumstick is
fat.
less.
usually
That's why it's
fried.
always the
Yeah.
breast.
Yeah.
Breast is the best.
and like the thigh.
Breast is the
Doesn't
best.
taste the best. I like
Yeah.
thighs. Thighs,
Yeah, yeah,
thighs
for
are
sure,
breast,
for
thighs are
sure.
best, but
But anyways,
Can you elaborate?
yeah, the chicken breast.
Tell us more.
I'll set up.
About a good 8 ounce of chicken breast, you get probably about 40-45 grams
There
of
you
protein in that.
Yeah,
That's what
exactly.
we're talking
There you
about,
go.
man. Jeez, girls, come on.
8 ounces
Go to
would be
Roscoe's.
juicier.
Yeah, let's
8
go to
ounces would be
Roscoe's.
juicier.
Roscoe's.
Yeah,
But
yeah.
I was like, that came out
never
very
had chicken
quick.
Yeah. It was very quiet when you said that. Yeah.
So what about beef? If
Beef is good.
I know, but what's how much
nothing wrong
beef
with
to get?
Yeah, how much beef?
Yeah, how much beef to get? So
I mean, the problem with
Say
beef
50
is
A little bit more, just a little bit more.
It comes with a lot of fat.
Yeah,
Depending
so
on-
beef,
Yeah.
beef is
Depending on
going to
what
be
cut.
higher in
Depending on
fat.
what cut.
Yeah.
Depends on what cut.
Yeah.
okay.
But usually, like I said, fish is probably going to be the one that has the least amount of fat if you really
yeah.
think about it. So that's one of those where
So the thing with strength training is that nobody talks about it because we all talk about cardio and walking and treadmill. Nobody talks about the importance of strength training, which is why it's cool that you guys are all like trainers, right? Like, how do you get people into the gym to tell them the importance of strength training? Nobody talks
You
about it.
don't.
You don't.
It's hard. I mean, even if you look at the penetration rate, even when I was working in the retail fitness industry, it was less than 10% of the members were still coming in. People that actually signed up with a membership at a gym, only 10% of those people were coming in regularly.
Like 24-hour fitness.
Yes.
Yeah.
something like- And I think it's one of those where us as trainers, as coaches, our job is just to mainly find the importance on the why. Why is this? Why is that? And me being like, I'm saying, I'm noticing most of my clientele is now over the age of 50. And I would probably say 90% of my clientele are women. These are women that have not been introduced to weights their whole life, and they're getting introduced to strength training at the age of 50, right? And that's one of the things that I think we have a lot more facts out there. We have a lot more information on what the body does. I mean, women in 50s go to menopause. When that happens, osteoporosis,
And they get brain
increases.
fog.
They get brain fog
with
so,
menopause.
Yeah.
So a lot of the times too, I got some clients even in their 60s and 70s. They all tell me the same thing. I wish I would have done this in my 20s. I wish I would have done this more. So I think it's more of, like I said, once again, going back to our podcast of 3 generations, is his generation informing us the importance of strength training now, where now our job is to re-elaborate it and re-push it.
Right.
So I think it's just like, how do we do it? It's like we explain to them the benefits of it.
Even though they don't come in specifically for like, oh, I just want to be healthy. Like generally it's more so like, I want to look good, right? So
Yeah.
I think we try to bridge the gap between what they want and then give them also what they need.
A lot of the problems with the older generation is that their doctors tell them, you need to go to the gym, you need to exercise. So it's more of a forced situation for them because they've never done it before. Now the doctor's telling them it's important for you to go to the gym. So you need to go to the gym. So they're kind of, okay, well,
Right.
I'm gonna go. But it's not like they're like, all right, I'm gonna go work out, and have a good workout.
What's their why? Like, what's for your clients? What's their why?
It's not so much why. I think part of the problem is the way the industry markets itself. It's not. It's just most people are adverse to exercise. They don't want to feel pain or any kind of discomfort. Most people are go, hey, I'm going to go work out and get sore and push my lungs and push my heart. And the average person does not want to feel that. They just don't.
Yeah.
And which is why you have a hard time. And then the industry on top of that, even when they introduce people to training, like the retail corporation that I used to work for, would just kind of blast them through, and there was no relationship building. There was no trust factor being built. You have to kind of ease people into exercise so that they actually kind of like it. They have to like what you do. It's the same thing with food. If you try to force someone to eat something that they're not going to like or follow, then what's the point?
Yeah.
And that's the problem with exercise. You have to kind of somehow make it enjoyable.
And I think that's the importance of us. You know, the four of us up here, you've worked with you. I mean, Stan's your personal trainer. You know the importance of having someone there for the hour to not just make it beneficial, but also make it enjoyable. And then you just mentioned something too. Right before you mentioned about not being too sore. When people go in and go too hard, uneducated, and they get too sore, they're not going to continue working out.
Yeah.
So our jobs as professionals is to like learn how to ease their ways into that to make sure you're not, you know, crashing into a wall.
Yeah.
And I think a lot of it going, like I said, coming back to your why is a lot of the whys is what Kyle was saying, right? A lot of them come in for aesthetics, you know, hey, I just want to lose this, I want to lose that. But as you know, you build that relationship and rapport, as Stan says, we can dig even deeper. And it's like looking into the future, you know, this whole podcast you've been saying, it's all about lifestyle, right? It's all about lifestyle, exercise, what you eat. And this is, like I said, this is something that I'm going to be sharing with my younger clients. It's not just going to be, you know, I'm going to share it to my older clients as well, because in the long run, if we can build these habits at the age of 20, you know, and you're limiting risks, the main thing too, I've always said, I don't want to be living off of a pill popping thing. You know, I've gone out and with a family member and we go eat, but they have a pill for Monday, Tuesday. I don't want to live like that in my 50s.
Yep.
So that's my motivation. That's my why right now. But I feel like if we can kind of build that and bridge that gap with the general population, that's where I think our job kicks in to keep them motivated and keep them going.
Yeah.
And I think, like I said, you giving us the information of what's out there, of what the future looked like when you're not exercising. You know, I just found out Alzheimer's is a disease that kills people. I just thought it was a memory loss thing.
No.
Now it's like something where it's like, if I'm sharing this and you're telling us all this valuable information on how we can prevent it, this whole episode is a huge why into keeping the general population working.
Yeah.
And Alzheimer's is debilitating. There's a ripple effect. It affects the other family members. And not only that, it drains resources. It not only does it drain money, time, and relationships, and you get caregiver burnout. So most of the caregivers for Alzheimer patients tend to be family members, right? So they have to either quit their jobs or take less pay, so you don't have to pay someone else to come in, right? And then you have to face the facts of burnout, and just all the resources become strained. So there's a huge ripple effect with Alzheimer's disease.
See, man? So, Mike, yes, we pick on you because you're an example of what we want to be in our 60s, because look how great you are.
What we talked about earlier, you know, about exercise, and I tell these guys this, you know, when you're a senior, that is not on the top of your list. Okay, and when you go to your doctor, you've even talked about this, that when you go to your primary doctor, he gives you what, 7 to 15 minutes? How much can he tell you within that time frame, except you got to go to the gym? No reason why you need to go to the gym, but you need to go to the gym and exercise to get your health better.
Yeah.
So, you know, primaries, they don't give you the full story of your health.
There's no focus on prevention.
Right.
You only go there when there's a problem.
Right. When you go in, the doctor says, well, look, you're way overweight and this and that, you know, you need to go to the gym. But, you know, if you've never gone before, that's probably the scariest thing, is walking through them doors. And these guys talk about the first step in fitness is walking through the doors. So, you know, I always tell people, because they ask me all the time, you know, you're always in the gym working out. You're always, you know, it's the best medicine you can get.
It is the best.
Working out, you know, with a consistent training program and listening to your trainers. But, you know, it's not as easy as people think, you know.
Yeah, it's a lifestyle. It has to be just integrated into just your lifestyle, your daily schedule, the exercise part. Right. It's if it's one of those things you try to plug in to an already busy lifestyle, is I'll do this once in a while, it just doesn't work. Go back to your old ways. So it's,
I mean, it's the worst thing is to have to sit down with the family and, like you said, open up a thing and pop. Yeah, this is Monday. I got to take all these pills right here. You know, I think being on medication is not always the answer.
Not at all.
You know, I think a lot of it can be prevented by just, like you said, lifestyle and exercise is really the answer to all this. So it's just getting seniors into exercise
Yeah.
and getting them to try to live a better lifestyle, eating better, exercising,
Build muscle.
you know, walking.
Yeah, having that accountability is super important
Mm-hmm.
because we all know what we ought to do, right? Like if you want
Kept
to lose
saying that.
weight, you know what you ought to do
Yeah.
to lose weight. But if you know what you're supposed to do, then why is it that in the United States, 2 out of 3 of us are like overweight, right? or 2 out of 3 of us, or half of us have diabetes, when you know diabetes is primarily lifestyle, it's nutrition, it's diet. So knowledge is not enough. Knowledge is not enough. Which is why I have a personal trainer, right? I've been with Stan when I was in my 30s. Now I'm in my mid 50s, right? And I do that because I will never show up to the gym unless Stan's waiting.
Accountability
Yeah.
piece.
Oh, I don't want him to wait. Right? I gotta show up. Right? It could be 5:30, 6:30 a.m. I would never show up to the gym. So to move from knowledge to action is where having a trainer or a coach, right, is absolutely required. Because to move from knowledge to actually implementation, you need 2 things. You need support and you need accountability. If you're not accountable to anyone to show up to the gym, you're just not going to show up to the gym. If you don't have that support, meaning, you know, like somebody's going to watch me when I'm doing the bars, or somebody to kind of keep an eye on me, it just ain't going to happen. So to move from knowledge to action requires accountability and requires support. And that's where a trainer comes in to keep you accountable and the support. And yeah, it's so important. That's why we have in these clinical trials we do that show success. It's successful because the people actually are doing it with a health coach or a trainer.
That's awesome.
Right? To show the positive difference in cognition and memory changes. It's because we know that if we just told you to go home and exercise and be on a low-fat diet, it ain't gonna happen.
No.
And this is what's happening at the doctor's office. When they talk about exercise and weight loss, they only say one sentence: go exercise.
Yeah, but
There's no accountability. There's no support. It's one sentence. This is why there's no change in the United States, and people are still overweight. They still got diabetes because the one sentence ain't gonna move the needle.
Yeah,
by
there's
just saying it.
There's no buy-in to that. I don't see the
no
value
buy-in.
yet.
I know, you know, you get to a certain age, hospitals, they actually require you to go in for a psychological test, you know, and they'll do whatever they can do. They'll give you a gift card. They'll do whatever they can do to get you in there, just to get that psychological test, you know.
Yeah.
And so they do, you know, for seniors, you know, that is a problem, you know, they're trying to attack by getting you to come in to see where you are if you're in that range of Alzheimer's or dementia. See, so yes, I do know that.
No, that's good.
but to
I've
add to
gotten a couple of gift cards, bro.
yeah, but to add to the accountability thing that Doc was bringing about, the individual has to make a conscious choice.
Yeah.
It is still choice, and once that choice is made, you have to make that commitment. And that's the one thing Doc has done is he not only made an initial choice, has obviously shown through his behavior the commitment to exercise, and that's why he's been able to reap the benefits of exercise. And I think that's where individuals who are listening to this really need to look within themselves and make that decision for themselves. Do I want to make a change, and which behaviors do I need to change? Right. And once you make the commitment, then you will start to see the results. But the commitment has to be made. Not the accountability and the social support is nice, but the commitment has to be there.
And I think
That
one
was
of the
deep. That was
hardest
well
things
said.
for seniors is to make that commitment, you know, because they haven't done it if ever done it. Now they have to do it, and it's really difficult, you know.
Never too late to start though. Yeah, at any age.
Only
Yeah.
to prevent muscle atrophy.
Yeah,
Definitely, it's trust me. Yes, it does. It's
it's
reducing the muscle. You
it
know?
is a huge. Think of the brain like a muscle.
Yeah.
You gotta use it or lose it.
Nice. Well, now,
Yeah,
Doc,
yeah.
I mean, I want to just say thank you. I was about to say,
Yeah.
I know
This
last
is a
few
very
minutes,
important
this is-
episode.
Yeah, these last few minutes. I know I want you to plug yourself a little bit more. I know you have a organization, Tongues Out, or if you can speak on that a little bit.
Oh,
Yeah. Just
yeah. I'm a medical missionary. So yeah, every year we are in somewhere in the world. So in July we're in Vietnam. We normally do Vietnam about once a year. So we've been to Vietnam about 10 times. We've been to Haiti about 10 times to do medical missions work there. Next year we're planning Peru. Been to Peru 4 or 5 times already. So every year we're somewhere around the world. I just take volunteers, doctors, nurses, high schoolers, college students, and we go and just show God's love. Yeah, through our skill set, which is health and medicines and things of that sort. And that's what we do.
Man, you've been doing God's work in more ways than one, Doc. So I really appreciate it. Any social media handles, websites where our listeners and followers can find you? And-
I mean, if they're on Facebook, I'm on Facebook. It's Health Talks with Dr. Trinh. Or you can go to, YouTube, Health Talks with Dr. Trinh. You can usually find me. And of course, we have a podcast and all that. But would love to promote you guys as well.
Of course.
Because
Thank you.
I
Appreciate it.
think strength training, especially strength training and exercise, is so needed in the U.S. I think truly that being sedentary is now the new smoking. And we're sedentary all day because most people sit and work on their butts all day, right?
Yeah.
And so we have these risks. And drop by on at my talk on November 15th at Refuge Church here in Huntington Beach. I'm going to promote strength training quite a bit. Invite your clients and all that.
Well, we'll let them know.
we can get on stage and flex.
There you go. Flex and release.
Yeah, exactly.
Help us build our new brain cells.
Shirts on.
Thank you.
Yeah,
Thank you.
exactly.
With shirts on or off? I'm just kidding.
Yeah,
So
exactly.
once again, man, we're gonna wrap it up.
Yes,
I wanted to
yes.
firstly
Thank you again, Doc.
Thank you, Stan. You guys were really honored, and thank you for sharing your knowledge and wealth. Like, comment, subscribe. Please leave a comment, and if you have any questions, comment those questions towards our guest right here, and make sure we'll get back to you guys as soon as possible. I'm Coach Cisco.
Coach Michael.
Coach Kyle.
Stan.
There you go.
Stan.
We'll catch you guys on the next episode. Thank you.
Take it
Thank
easy.
you.